We will be discussing the topic of right heart failure, arised by the inability of the right side of the heart to effectively condition that requires a thorough understanding of its physiology, clinical presentation, diagnosticated complications. Throughout this lecture, I provide you with a comprehensive understanding of RHF. RHF occurs when the right ventricle fails to pump blood efficiently into the pulmonary circulation. It can result from various underlying heart conditions, such as pulmonary hypertension, right ventricular infarction, congenital heart diseases, or acute cor pulmonale. Understanding the underlying causes and mechanisms of RHF is crucial for its diagnosis and management. In the subsequent topics, we will explore these aspects in detail. To comprehend RHF fully, we must first have a solid understanding of the anatomy and physiology of the right heart. The right heart is responsible for receiving deoxygenated blood from the body and pumping it to the lungs for oxygenation. It consists of the right atrium, right ventricle, tricuspid valve, and pulmonary valve. In this topic, we will explore the structure and function of each component in depth. Many factors can contribute to the development of RHF. Common etiologies include chronic pulmonary diseases, left-sided heart failure, valvular disorders, myocardial infarction, and congenital heart defects. Additionally, risk factors such as smoking, obesity, sedentary lifestyle, and aging can increase the susceptibility to RHF. We will discuss these etiological factors and identify the associated risk factors. A detailed understanding of the pathophysiological mechanisms of RHF is vital for accurate diagnosis and appropriate management. The pathophysiology of RHF involves alterations in pressure and volume overload, impaired contractility, structural abnormalities, and neurohormonal activation. This topic will explore these mechanisms and their interplay in the development and progression of RHF. Recognizing the clinical presentation and symptoms of RHF is crucial for early detection and treatment. Patients with RHF may present with symptoms like swelling in the lower extremities, edema, shortness of breath, fatigue, liver congestion, and jugular venous distension. This topic will provide a detailed overview of these symptoms and discuss their significance in diagnosing RHF. Accurate diagnosis of RHF requires a comprehensive diagnostic evaluation. This includes a detailed patient history, physical examination, laboratory tests, electrocardiography, echocardiography, and hemodynamic monitoring. Understanding these diagnostic approaches and their interpretation is fundamental to effectively diagnosing and managing RHF. The management of RHF aims to alleviate symptoms, improve cardiac function, and address the underlying cause. Treatment approaches may include lifestyle modifications, medication therapy, surgical interventions, and cardiac rehabilitation. This topic will expound upon these treatment modalities and discuss their efficacy and potential complications. Right ventricular infarction, RVI, is a significant cause of RHF, often associated with acute myocardial infarction involving the inferior wall of the heart. Differentiating RVI from left ventricular infarction is crucial for appropriate management. In this topic, we will discuss the clinical presentation, diagnostic approach, and treatment considerations for RHF associated with RVI. Pulmonary arterial hypertension, PAH, is a progressive disease characterized by increased pulmonary vascular resistance, leading to right heart dysfunction and RHF. Understanding the relationship between PA and RHF is pivotal for optimal management. This topic will explore the pathophysiology, diagnostic evaluation, and treatment strategies for PA and its association with RHF. Congenital heart diseases, CHD, are structural abnormalities present from birth that can contribute to RHF. Understanding the anatomical defects, hemodynamic consequences, and management considerations associated with CHD is essential for effectively diagnosing and managing RHF in these patients. This topic will delve into the various types of CHD and their impact on RHF. Acute cor pulmonale refers to a sudden onset of right heart failure caused by acute pulmonary embolism or acute respiratory distress syndrome. Early recognition and prompt intervention are crucial in preventing adverse outcomes in these cases. This topic will elaborate on the clinical presentation, diagnostic evaluation, and emergent treatment approaches for acute cor pulmonale and RHF. The prognosis of RHF depends on various factors, including the underlying cause, severity, and timely management. Complications associated with RHF include arrhythmias, fluid overload, liver dysfunction, renal impairment, and mortality. Understanding the prognostic indicators and potential complications will guide clinicians in formulating optimal management plans. A condition that demands a comprehensive understanding of its pathophysiology, clinical presentation, associated complications. By exploring each of the complexities of RHF, it is essential to minimize the diagnosis and management of this condition, if you have any.